Hi everyone, my name is Charisse and my presentation is about Shigella. So in this video I'm going to do a brief introduction, go over the history and prevalence, some diagnosis methods, mechanisms of resistance, risks, treatment and prevention, and then a short activity at the end. So Shigella is a part of the Enterobacteriaceae family. It's a virulent gram-negative bacilli, which is genomically very similar to E. coli since they're from the same family. Humans are the only natural reservoir, and there are 4 main species: Sonii, which is the most common in the US, Flexneri, Boydii, and Dysenteriae. So infection by Shigella is called shigellosis, or more commonly dysentery, which is characterized by bloody or watery diarrhea, as well as vomiting, stomach pain and cramps, and fever. It's spread through the fecal-oral route of transmission through direct contact with infected individuals or contaminated food, water, or surfaces. And it's highly infectious because only a really small dose is needed for infection, and it's often associated with poor hygiene. So here's a brief history beginning in 1897 with its discovery by Kiyoshi Shiga, a Japanese microbiologist, who successfully isolated Shigella dysenteriae from the stool of dysentery patients, and it's named after him. In the early 1900s, more strains were discovered, including the 4 species covered in the earlier slide. And then in the 1940s, some antibiotics were developed or discovered to be effective, including sulfonamides, tetracycline, and penicillin. But in the late 1950s is when we begin to see resistance emerge, and then fast forward to 2022, there's a sudden sharp increase in the number of extreme drug-resistant strains. So the global prevalence of Shigella, it's the leading cause of diarrhea worldwide, and it's endemic in low and middle income countries like Africa, Asia, South America, and this is due to a lack of access to sanitation and public health resources. It's most common in children under 5 years old, and resistance is increasing worldwide, which is also associated with increasing rates of morbidity and mortality. Some methods of diagnosis, so the symptoms of dysentery, acute diarrhea, vomiting, stomach pain, and then often inquiry about recent social history such as international travel, sexual activity, and housing status. And then stool culture, which is then used in whole genome sequencing, which is recommended by the CDC. So common mechanisms of resistance are decreased cell permeability, efflux pumps, target modification through mutation, and then overexpression of drug modifying and inactivating enzymes. And if you look at this figure to the right, you can see that there has been an increase in extreme drug-resistant Shigella, especially Sonii strains, since 2016, with a sudden rapid increase in 2022, which is a major global health concern since extreme drug-resistant strains are resistant to almost all antibiotics. And there's approximately 242,000 antimicrobial resistant Shigella cases in the US every year. So some individuals that are especially high risk are children under the age of 5, unhoused individuals, men who have sex with other men, international travelers, especially those who may have traveled to endemic areas or places with unsafe food and water sanitation, as well as immunocompromised individuals who are not only more susceptible to infection, but also more susceptible to the infection progressing to a more serious disease like hemolytic uremic syndrome, which can lead to kidney failure. So treatment is usually not required since most cases are super mild with recovery in 5 to 7 days, so just fluid and rest. But in more severe cases, antibiotics like ciprofloxacin and azithromycin might be prescribed. So prevention is key. So there's no vaccine currently available, but practicing good hygiene like washing your hands, food safety, safe sex practices, and staying home if you're infected to prevent spread of disease are super important. For healthcare providers, it's important to report all known cases, especially extreme drug-resistant cases, as well as providing accurate diagnosis and treatment. And then globally, of course, judiciary use of antibiotics and public health education resources can help prevent spread and resistance. Now on to our short activity. This is called the Poopy Picnic Mystery. So somebody spread Shigella at the picnic. Can you find out who it was before it's too late? So here's what everybody brought: watermelon slices, sandwiches, lemonade, salad. So everyone's eating, having a great time, and all of a sudden, people begin experiencing stomach pain. And sadly, everyone is unaware of the importance of disease prevention, so nobody washed their hands when preparing food that morning. So earlier that day, Blake did not wash his hands after using the bathroom, but he's not feeling sick. Tina just returned from a trip to an area endemic for Shigella 3 weeks ago, but she did not get sick. Penelope, the day before the picnic, went swimming with someone who was infected a week prior, and she's had acute diarrhea ever since. And Michael had Shigella 2 weeks ago. So I invite everybody to pause the video right now if you want to think for yourselves who might have brought the Shigella. And so who did it? It was Penelope. And why did this happen? So Blake had no symptoms indicating shigellosis. Tina didn't get sick during her trip, and 3 weeks later there's no risk of infection spread. After 2 weeks, Michael's no longer at risk of spreading infection either. But for Penelope, it's recommended that anyone who is infected stay out of public pools for at least 2 weeks, since it can spread through contaminated water. So Penelope likely contracted Shigella from her friend. And last question is, what should everybody probably stay away from at the picnic? It's the sandwiches. So thank you, everybody. And here are my references, and thanks for watching.